Monday, September 11th, 2023, AGNDD Intellireport topic. Mifepristone. Please pardon any visual and informational inaccuracies in this entirely AI-generated Wikipedia-sourced video article.
Mifepristone is a medication commonly used for medical abortion, but it also has other medical applications, such as treating high blood sugar in patients with endogenous Cushing syndrome. Mifepristone, followed by a prostaglandin analog, is a safe and effective method for medical abortion. Medical organizations, including the Royal College of Obstetricians and Gynecologists, recommend this combination for abortions at any gestational age. The World Health Organization and the American College of Obstetricians and Gynecologists also recommend this combination for first and second trimester abortions. Mifepristone alone is less effective, with varying success rates according to studies. Mifepristone is a medication used to treat high blood sugar caused by high cortisol levels in adults with endogenous Cushing syndrome. It is specifically used in patients who also have type 2 diabetes or glucose intolerance and have either failed surgery or are unable to undergo surgery. Mifepristone is a medication that has various uses in reproductive health. It can be used as emergency contraception at low doses and in combination with misoprostol for early pregnancy loss. Mifepristone is also used to treat symptomatic leiomyoma, also known as uterine fibroids and endometriosis. Serious complications with mifepristone are rare, with a small percentage of women requiring hospitalization or blood transfusion. Most women experience abdominal pain, cramping, and bleeding for about 9 to 16 days. Severe cramps can be managed with ibuprofen, and some women may experience bleeding for 30 days or more. Other side effects include nausea, vomiting, diarrhea, dizziness, fatigue, and fever. Pelvic inflammatory disease is a rare but serious complication. Excessive bleeding and incomplete termination may require further intervention. Mifepristone is contraindicated in certain conditions and is not effective for ectopic pregnancy. A small number of deaths and other adverse events have been reported. Long-term studies to assess the cancer-causing potential of mifepristone have not been conducted. This is because international guidelines do not mandate carcinogenicity testing for drugs that are not genotoxic and are intended for use for less than 6 months. Mifepristone alone can result in abortion in 54% to 92% of pregnancies, but the effectiveness increases to over 90% when misoprostol is used in combination. There's no evidence that the effects of mifepristone can be reversed, despite claims made by some anti-abortion groups. Giving progesterone has not been shown to stop medication abortion, and not completing the full regimen of mifepristone and misoprostol can lead to serious bleeding. There is a risk of birth defects if pregnancy continues after using mifepristone and misoprostol. Studies in animals have shown some developmental abnormalities. Mifepristone is a steroidal antiprogestogen that acts as a progesterone receptor antagonist. It also possesses anti-glucocorticoid and weak anti-androgen properties. Mifepristone has the ability to prevent ovulation and can be utilized as both a regular contraceptive and an emergency contraceptive. By blocking progesterone receptors, it induces endometrial degeneration and trophoblast detachment, ultimately resulting in abortion. Mifepristone is often referred to as a contragestive since it can potentially function after fertilization but before 9 weeks of gestation. The elimination half-life of mifepristone, a medication used for various purposes including abortion, is initially slow and then becomes more rapid. The concentration decreases by half between approximately 12 and 72 hours, resulting in an elimination half-life of 18 hours. However, when using radioreceptor assay techniques, the terminal half-life can be up to 90 hours, including all metabolites of mifepristone that can bind to progesterone receptors. Mifepristone is the primary metabolite of mifepristone. Mifepristone is a synthetic steroid that is similar to hormones like progesterone, cortisol, and testosterone. It has specific chemical substitutions and double bonds at certain positions. In April 1980, researchers at the French pharmaceutical company Roussel-Uclaf synthesized mifepristone as part of a project to develop glucocorticoid receptor antagonists. They discovered that mifepristone also acted as a progesterone receptor antagonist. In October 1981, tests were conducted on 11 women in Switzerland, and successful results were announced in April 1982. After worldwide clinical trials, Roussel Uclaf sought approval for Mifepristone's use in medical abortion, which was granted in France in September 1988. On October 21, 1988, Roussel Uclaf, a pharmaceutical company, decided to stop distributing Mifepristone due to anti-abortion protests and pressure from its majority owner, Hoechst AG. However, the French government intervened and ordered the company to continue distributing the drug for the sake of public health. Mifepristone was then made available to women in France, with 34,000 women using it between April 1988 and February 1990. In February 1990, Roussel Uclaf began selling Mifepristone, to hospitals in France at a negotiated price. Mifepristone, also known as Mifepristone, was approved in Great Britain in July 1991 and in Sweden in September 1992. However, the chairman of Hoechst AG, Wolfgang Hilger, who was a devout Roman Catholic, blocked further expansion of its availability until his retirement in April 1994. On May 16, 1994, Roussel Uclaf donated all rights for medical uses of Mifepristone in the United States to the Population Council, which licensed it to Danco Laboratories. Mifeprex, the brand name for Mifepristone, received FDA approval on September 28, 2000. In 1997, Hoechst AG announced the discontinuation of its production and sale of Mifepristone. The rights for medical use of Mifepristone outside of the United States were transferred to AGNDD SA. This decision was made to prevent anti-abortion boycotts. AGNDD, a newly established company under the leadership of Edouard Sakis, former CEO of Roussel Uclaf, successfully obtained approval for Mifepristone in 11 additional countries by 1999. Over the next decade, AGNDD expanded its reach to 28 more countries. In 2019, GenBioPro introduced the first generic version of Mifepristone in the United States. This marked a significant development as it provided an alternative and potentially more affordable option for individuals seeking this medication. Mifepristone is commonly used for medical abortion and is also used in combination with other drugs for various medical purposes. The availability of a generic form expanded access to this important medication. Mifepristone is a medication that is considered essential by the World Health Organization. It has been included on the core list since 2019, along with misoprostol. However, its use is subject to national laws and cultural acceptance. Access to certain resources or services is limited in many parts of the world due to cost and availability constraints. This means that people in these areas may not be able to afford or easily obtain the resources or services they need. This can have significant implications for their quality of life and opportunities for development. The percentage of medication abortions in the United States has been increasing every year since the approval of Mifepristone. In 2000, it was 1.0%, and by 2020, it had reached 54%. Medication abortions accounted for 20.3% of abortions at less than 9 weeks gestation in 2007, and 94% of non-hospital medication abortions used Mifepristone and misoprostol. Planned Parenthood clinics performed 32% of first trimester medication abortions in 2008, and in 2014, medication abortions accounted for 31% of abortions performed in non-hospital facilities. The percentage of medication-based abortions is on the rise in France, England, and Wales, Scotland, and Sweden. In France, it went from 18% in 1996 to 49% in 2007. In England and Wales, it increased from 5% in 1995 to 40% in 2009. In Scotland, it rose from 16.4% in 1992 to 69.9% in 2009. In Sweden, 68.2% of all abortions in 2009 were medication-based. Mifepristone is commonly used in these countries for medication abortions. In Denmark, Mifepristone was used in around 3,000 to 4,000 of over 15,000 abortions in 2005. Mifepristone, a medication utilized for abortion, gained FDA approval in the United States in 2000. It was initially exclusively obtainable through licensed physicians and marketed as Mifeprex. Distribution and accessibility restrictions have fluctuated among states over time. In 2021, the FDA eased the in-person acquisition requirement for the drug in response to the COVID-19 pandemic. In 2023, additional regulations were relaxed, permitting any retail pharmacy to dispense Mifepristone prescriptions. While certain states have imposed limitations on abortion pills, the legality of delivering the pills via mail has been confirmed. Some drugs, like Mifepristone, are approved by the FDA under subsection H, which has two parts. The first part allows for the expedited approval of experimental drugs for serious conditions. The second part applies to drugs that have safety restrictions and require post-marketing surveillance. Until December 2021, Mifepristone was approved under the second part, which meant that women had to get it directly from a doctor instead of a pharmacy. This was because the drug can have adverse reactions and requires medical supervision. The approval included a black box warning. Mifepristone, marketed as Mifepristone outside the United States, is approved for use in several countries. It was first approved in France in 1988 and has since been approved in various European countries, including the UK, Sweden, Germany, Spain, and Italy. It is also approved in countries like Norway, Russia, Ukraine, Serbia, Montenegro, and others. However, it is not available in Poland, where abortion is highly restricted. Mifepristone is licensed for early first trimester medication abortion, second trimester medication abortion, cervical softening and dilation, and induction of labor after fetal death in utero. Mifepristone, a medication utilized for medical abortion, has gained approval and legalization in multiple countries worldwide. In 2006, Australia lifted the ban on Mifepristone, enabling its usage in dedicated abortion clinics. New Zealand, Israel, China, Taiwan, Vietnam, South Africa, Tunisia, India, and Canada have also granted approval for the utilization of Mifepristone. Nevertheless, regulations and accessibility differ in each country. Certain countries impose restrictions on its usage, while others have witnessed the emergence of illicit markets for this medication. Anti-abortion groups in the United States and other countries have actively campaigned against the approval and use of Mifepristone, citing ethical concerns and safety issues. However, a recent decision by a U.S. appeals court has upheld limited access to the abortion pill, which is seen as a victory for reproductive rights advocates. This decision highlights the ongoing battle over abortion access and the need for continued advocacy efforts. The research group initially focused on finding compounds with anti-glucocorticoid properties for the treatment of severe mood disorders and psychosis. However, the efficacy of these drugs in mood disorders is still uncertain. Mifepristone has been studied as a cervical ripening agent and an anti-androgen for prostate cancer, but it did not show any anti-HIV activity. While it initially showed promise in treating psychotic major depression, a Phase 3 clinical trial was terminated early due to lack of effectiveness. It has also been studied in bipolar disorder, post-traumatic stress disorder, and anorexia nervosa. In conclusion, the combination of Mifepristone and a prostaglandin analog is recommended by medical organizations for safe and effective medical abortions at any gestational age. Mifepristone alone is less effective and has varying success rates. Additionally, Mifepristone is used to treat high blood sugar in adults with endogenous Cushing's syndrome and type 2 diabetes or glucose intolerance.
Thank you for watching this AGNDD Intellireport. Like, subscribe, and click the bell button to get notified during new uploads. And make sure to tune in next time. Stay safe and healthy. Cheers.